Good morning, students. We are very happy to see you all once again for this next session. So we are going to start our health expert talk within few minutes. We are just waiting for a few more students to join. A doctor gives life to the patient through medicines. A pharmacist gives life to medicines through his knowledge and skills. I'm not a doctor, but I serve humankind to make sure that they are relieved from pain. I'm a pharmacist. Here we have such a pharmacist and also doctorate, Dr. C. Senthil Kumar, Professor and Head, Department of Pharmacology, Karpam College of Pharmacy, Coimbatore. Dr. C. Senthil Kumar has completed Doctor of Philosophy in JJT University and postgraduate diploma in Clinical Research from Resolve Clinical Research India. He also worked as a Clinical Research Associate, in pharmacokinetics in Quest Life Science Private Limited, Chennai. He has received Certificate of Appreciation Award as a judge for poster presentation International Research Conference on Pharmaceutical and Allied Sciences at UCSI University, Malaysia. He has been appointed as NSS Program Officer and conducted more than 10 blood donation camps and various cleaning awareness programs. He has organized 5 pharmacological seminars and symposiums. As an editor, he is a reviewer of Omen Journal of Medicine, editor of Journal of Nanomedicine and Nanotechnology, International Journal of Pharma and Biosciences, reviewer of Journal of Young Pharmacists. He has completed 30 publications and handled 35 research projects. He has keen interest in researches like molecular pharmacology, nanotechnology, toxicology, nanopharmacology, virtual screening, and drug discovery. We are very glad to invite such a versatile personality, Dr. C. Senthil Kumar, to innovate on pharmacological and non-pharmacological approaches for COVID-19.
Thank you, madam.
Thank you, sir.
Thanks for your introduction. Shall I share the screen now?
Yes, sir. Yes, sir. You can.
But once again, I'll see where it is there. My slide is viewing, ma'am. Can you able to see my slides?
Hello, sir. Your slide is not visible, sir.
One second, sir. I'll see. Student desktop. Can you see my slides, sir, now?
No, sir. No, sir.
One second.
Sir, could you see the share screen button, sir? Yeah, sir. It's 1 second, sir. Yeah. Now it is visible, sir.
Yeah. Okay.
Thank you.
First of all, thank you, sir. Thank you very much for doing this thing. Good morning, all. First of all, I would like to thank KIT, the Kappam Institute of Technology, principal and coordinator, Dr. Gobinath sir, who is given this opportunity to deliver a topic on pharmacology and non-pharmacological approaches for COVID-19. So before I'm going this topic, let me discuss வள்ளுவன் கூற்றுக்கிணங்க நோய் நாடி நோய் முதல் நாடி அதுதணிக்கும் வாய் நாடி வாய்ப்பச் செயல் என்ற வள்ளுவரின் கூற்றுக்கிணங்க என் உரையை தொடங்குகிறேன். இது எல்லாத்துக்கும் தெரியும் இந்த குறளோட அர்த்தம். நோயை இன்னதென்று அறிந்து நோய்க்கான காரணத்தை கண்டுபிடிச்சிட்டு அதை தணிக்கும் விதிகள், அதை தணிக்கும் மருந்தை வந்து கொடுத்தாதான் உடம்புக்கு நல்லதுன்னு வள்ளுவர் கூற்றிருக்கணுங்க. கிட்டத்தட்ட 1500 வருஷத்துக்கு முன்னாடியே வந்து பேத்தோபிசியாலஜி, பார்மகாலஜி எல்லாம் இந்த 2 வரியில சொல்லிட்டு போயிட்டார். சரிங்களா? அப்போ இதுக்கு என்ன பண்ணணும், இந்த மாதிரி சுச்சுவேஷன் வரும் அப்படிங்கிறது கிட்டத்தட்ட ஒரு 1500 வருஷத்துக்கு முன்னாடியே நம்மளுக்கு எல்லாம் எடுத்து சொல்லிட்டு போயிருக்காங்க நம்ம மூதாதையர்கள். சரிங்களா? சில வேர்ட்ஸ் எல்லாம் I can use in Tamil also so that it will be beneficial for students. I think it's an orientation program. Okay, so it will be beneficial for you guys. So a glimpse of this session is epidemiology. So epidemiology in the sense what is history, where it is origin, and how COVID-19 is going to be originated, and so what are the transmitters in between. There is a in upcoming slides we are going to be seeing. Next is mode of transmission and stepwise approach to contact tracing of COVID-19. இப்போ ஒருத்தருக்கு வந்துருச்சு, அதை எப்படி ட்ரேஸ் அவுட் பண்றது அப்படிங்கிறதுக்கு there is a protocol will be there. Total there is a 6 steps is there on that. Okay, we'll discuss one by one. நம்ம வள்ளுவன் சொல்றதுக்கிற மாதிரி ஜீனோம் சீக்வன்ஸ் ஆஃப் COVID-19, அது என்ன டிசீஸ் அப்படிங்கறது கண்டுபிடிச்சுக்கணும். ஃபர்ஸ்ட் COVID-19 என்ன, அதோட ஜீனோம், அதோட ஜீன் எப்படி இருக்கும், அதோட DNA சீக்வன்ஸ் எப்படி இருக்கும் அப்படிங்கறதெல்லாம் வந்து வில் சி. நெக்ஸ்ட் இஸ் பேத்தோபிசியாலஜி, காரணம் என்ன, இந்த COVID-19 வர்றதுக்கான காரணம் என்ன. இந்த COVID-19 வந்ததுக்கு அப்புறம் the categorize the COVID-19 patients, how you are going to be categorized, either it is a initial stage or susceptible patients, or else there is a mild, moderate, severe, critical will be there. There are different categories will be there. Based on that we are going to be segregate the patients and we are going to be give a treatment. Okay, so once we are going to be categorize the patient only, it is not all the COVID patient required disease or drug. Okay, so there some patients is required only for the isolations or quarantine is sufficient for them. Okay, to control the spreading. Okay, some patients it required some medicines. I will discuss one by one. In that pharmacological approaches for COVID-19 we'll discuss. Non-pharmacological approaches. Non-pharmacological in the sense pharmacology and study of drugs, study of medicines is called as pharmacology. And the pharmacology illama என்னென்னலாம் பண்ணலாம், ஒவ்வொரு இண்டிவிஜுவலும் will take care of that. Okay, there is a different steps will be there from individual to country, from country to international. We are going to be achieve that. At last we are going to be achieve the goal or free of COVID-19 for every nook and corner of this world. Okay, so this is very pandemic situations. I think a lot of problem is going to be created. This Tamil இதுல சொல்ற மாதிரி பார்த்தா ஒரு அணு வந்து எல்லாத்தையும் வந்து சிதைச்சிரும் அப்படிங்கிறதுக்கு வந்து இது ஒரு உதாரணமா அமைஞ்சிருச்சு இந்த COVID-19 நம்ம காலத்துக்கு. At last we are going to be discuss about the conclusions. So this is the glimpse of this sessions what you are going to be discussing in upcoming slides. So epidemiology, coronavirus disease or COVID-19 is a respiratory infections. மெயினா வந்து தாக்கக்கூடிய ஆர்கன் பார்த்தீங்கன்னா வந்து நம்மளோட லங்ஸ் தான். Respiratory infections caused by newly emerging coronavirus that was first recognized in Wuhan, as we all know that China in the year of December 19. So while most people of COVID-19 develop mild or uncomplicated illness, approximately there is 14 developed a serious disease. Okay, 14% can be developed as serious issues or serious disease required for hospitalization or oxygen support sometimes because the lungs is going to be damaged. So this is the main organs, as we all know that. Okay, if it is not there, okay, lungs will not be properly function, so it won't be carry the oxygen. So every cells is required the oxygen. So once the lungs is going to be affected, the total system is going to be get collapsed. Okay, 5% required admission to intensive care units, only the 5%. Okay, don't be panic, everyone have. Okay, if you are going to be boost our immune system, we can escape from the COVID. Okay, the severe causes COVID-19 can be complicated by acute respiratory syndrome, that is pathophysiology நம்ம படிக்க போறோம். Sepsis and septic shock, சடனா வந்து septic shock ஆகி பிரெயின்ல போய் பிரெயினையும் கொலாப்ஸ் பண்றதுக்கு சான்சஸ் இருக்கு. Multi organ failure including acute kidney injuries as well as the cardiac injuries, because these two organ is going to be purified and pumping the blood. If blood will not contain oxygen, so the cells also is going to be automatically die. Okay, so that's why there is a lot of death is going to be occur, and also there is a cytokine stromes will be there. In this cytokine stromes, once is going to be created, there is an inflammatory marker is going to be massively released from the lungs, so it will be constrict the entire respiratory system. So the breathing trouble is going to be occurred for the COVID patients. Okay, so this is epidemiology. Where it is originated, we are all known that it is originated from the bat. Okay, vavval irundha the start ஆகுது. Intermediate பாத்தீங்கன்னா either it is a camel இருந்து வரலாம். நம்மளுக்கு வந்து there is a இது பேர் என்னங்கறாங்கன்னா zoonotic transmission அப்படிங்கறாங்க. ஒரு அனிமல் இருந்து ஹியூமனுக்கு பரவுச்சுனா அதுக்கு பேர் வந்து zoonotic transmissions. Okay, in the man வந்து can be communicated to the entire population. So there is a community contact once people affected in the COVID-19. So he may travel to the other countries, so that only it can be spreaded all over the world. Almost 130 around the globe, there is a 130 country is going to be affected, massively affected in Spain as well as America. In India also it is 3rd days. Soon is we are going to be reached if we are not controlled properly, or if we are not properly do whatever the measurement we are going to be say in future. Okay, there is a mask அணிஞ்சுக்கணும், அதோட distance விட்டு போகணும் அப்படிங்கிறது வந்து it is all in the it is our hand only. Okay, so that we can able to control COVID. Okay, and those who are hospitalized, from this hospitalized only, those who are working in healthcare providers, they were get a nosocomial transmissions. This is called as the nosocomial transmissions from affected person இருந்து healthcare providers வந்துச்சுன்னா டாக்டரோ நர்ஸோ ஃபார்மசிஸ்டோ அல்லது மற்ற டெக்னீஷியனுக்கோ வருது அப்படின்னா அதுக்கு பேர் வந்து nosocomial transmissions. இந்த nosocomial transmission can be affect the another person also. Suppose if it is a doctor also will not wear properly for the PPE, personal protective equipments proper போடல அப்படின்னாங்கன்னா they may also will get a so many incidents we have heard. Okay, ஒரு டாக்டர் இறந்துட்டாங்க, அந்த இறக்கிற டாக்டருக்கு வந்து ஃபியூச்சர்ல வந்து டிஸ்கிரிமினேஷன் இருக்கக்கூடாது, அவரு ஒரு உயிர், இதெல்லாம் வந்து எல்லாருமே மதிச்சு நடந்துக்கணும். Next is there is 3 categories we are going to be segregate for this mild infection, severe and intermediate infections. You can see the red mark is shows that severe infection. There is MERS, there is a Middle East respiratory COVID as well as the SARS. Okay, SARS-CoV-2. So these are all the very dangerous. That's why it is mentioned in a red mark. Okay, நம்ம சொல்றது வந்து எறும்பு திண்ணி. So intermediate coast பாத்தீங்கன்னா இங்க பாத்தீங்கன்னா there is a எறும்பு திண்ணி இருந்தா நம்மகிட்ட இதுக்கு வருது, நம்மளோட டிரான்ஸ்மிஷனுக்கு இங்க வருது. So next is mode of transmission of COVID-19. As we are all known that from since March onwards, we are saying that there is a direct contact by handshaking or saying high five. Okay, through that also it can be spread. And indirect contact, like if you are going to be touches any door, so that's why hand sanitizer also will be used in a pedal based hand sanitizer we have to use. We should not touch by hand. Once you are going to be touch the hand, immediately should not touch the face. Okay, so that's why we need to do the hand sanitizer. Okay, to clean out, or you have to wash the hands very frequently. There is 20 to 60 seconds. They were saying that there is 11 steps will be there how to wash the hands. So everybody will laugh. இதெல்லாம் வந்து ஏன் எடுக்கிறீங்க அப்படின்னா எப்படி ஒரு ஹேண்டை வாஷ் பண்ணணும் அப்படிங்கிறதுக்கு வந்து there is a procedure will be there. அந்த ப்ரொசீஜர் படி போனோம்னா இட் ரிக்வயர்ட் நம்ம ஒரு 2 seconds தான் நம்ம கழுவுறோம் எல்லாருமே. ஆனா வந்து 20 seconds கழுவுனா தான் அந்த இடுக்குல இருக்கிற எல்லா in between hands it will be goes. Okay, or otherwise it will be stay, and unfortunately will have frequent வந்து நம்ம முகத்திலயோ researcher is saying that there is a 300 to 400 times you are going to be touch our face. This is for the involuntary movement. Automatically we are going to be touch. Next is through droplet also it can be spread. Okay, தும்மும்போதோ இருமும்போதோ it can be spread. And next is the airborne disease, or if you are going to be cough or if you are going to be sneeze, it can be transmitted through the air. It can be around the population. Once you are there, then it will be. So that's why everybody is saying that 14 to 28 days we need to quarantine. 14 days is the incubation time. 28 days there is a after once the COVID is going to becomes 28 days we can able to know. Sometimes they were in a asymptomatic also. Sometimes they were in a symptoms can be shown. Next is fecal oral transmission. Even fecal also there is a sometimes there is a COVID-19 can be transmitted, and oral also. If you're going to be have contaminated hand or COVID, once you're going to be touching the any surface, okay, even there is a wood surface or a chair, everything can be through that also it can be transmitted. So this is the mode of transmission of COVID-19. Okay, next is இது வந்ததுக்கு அப்புறம் எப்படி ட்ரேஸ் அவுட் பண்ணுவாங்க அப்படின்னா, so there is a 6 steps I've told. Okay, contact tracing starts. Okay, once the first case is COVID is going to be identified in the particular area, for example ஈச்சனரியில ஐடென்டிஃபை பண்ணிட்டாங்க அப்படின்னா கான்டாக்ட் tracing protocol is going to be get activated. அதனால தான் நம்ம ஒரு ஆப் கூட டெவலப் பண்ணாங்க. Indian government is going to be initiated the app. Through that we can able to trace out through the GPRS. We can able to trace out the person who is affected in the COVID. Next is interview. Interview is must, because affect ஆயிடுச்சு அப்படின்னு சொன்னோடனே we have to interview them. Detailed discussion with the patients to identify the possible individuals who encounter the patients. Next is verifying the informations. This information, whether it is correct or not, through your neighbors or through your house owner. Sometimes if you are a tenant, they will verifying the information, how long it will be there in the outside, where it is gone. So all those things they will trace out. And then there is a fourth step is 4A and 4B will be there. Low risk exposure, close contact, no need to self isolation. They remain in a passive flow. Okay, they may go here and there, and officially they may not daily follow up for the 14 days. Whereas in high risk exposure, close contact will be there, undergo for the self isolation in home. Okay, நமக்கு தெரிஞ்சிருச்சு பாசிட்டிவா இருக்கு or high risk இருக்குது அப்படின்னா then we have to isolate ourselves. They remain an active follow up by officials. அதனால தான் வந்து நம்ம ஹெல்த் ஒர்க்கர்ஸ் எல்லாம் வந்து நல்லா ஒர்க் பண்ணாங்க. கோவிட் அந்த பரவற டயத்துல வந்து ஏப்ரல் மேல எல்லாம் வந்து வீடு வீடா போய் எத்தனை பேருக்கு இருக்கு இல்லைங்கிறதெல்லாம் வந்து such a difficult task also they were performed well. Okay, மாநகராட்சியில பண்றதெல்லாம் பெரிய வேலைகள். சென்னையிலையும் கோயம்புத்தூர்லயும் மற்ற எல்லா இடத்துலயும் வந்து மாநகராட்சி எங்கெங்க இருக்கும் ஒவ்வொரு வீடா போய் இது பண்றதெல்லாம் it is too difficult for them. Okay, so that's why everybody is saying that COVID warrior, we are saying that, or we are proudly saying that they are the COVID warrior. Okay, and if low, fifth step will be the if low or high risk close contact develop symptoms. Sometimes இது asymptomatic இருந்தா கம்பல்சரியா வந்து those who develop the symptoms undergo the isolation and COVID testing. Okay, symptoms இருந்துச்சு, கை கால் வலிக்குது, மசில் பெயினா இருக்கு, உடனே தொண்டை வலிக்குது, இமிடியேட்டா வந்து ஃபீவர் வந்து அன்கண்ட்ரோல் ஃபீவரா இருக்கு, there is a sustainable fever has to be there. 102 வந்து கண்டினியூஸா இருக்கணும். 1 or 2 days இருந்துச்சுன்னா இமிடியேட்லா we have to check. Okay, by do the COVID testing. There is PCR, polymerase chain reactions, or RT-PCR சொல்லுவாங்க அதுக்கு பேர். இந்த molecular testing எடுத்துக்கிட்டு we have to confirm it whether affected COVID or not. Next is once இதெல்லாம் முடிஞ்சதுக்கு அப்புறம் there is a recovery phase will be there. இதெல்லாம் வந்து 14 டேஸ்க்கு அப்புறம் குவாரண்டைன் இருந்துட்டு அவங்க எல்லாம் கரெக்டா குவாரண்டைன் இருக்காங்களா அப்படிங்கறத வாட்ச் பண்றதுக்கும் there is a periods. And also there is after 14 days health workers will be come and visit our home, whether we are there in a home or we are going to roam here and there. Once it is controlled, then there is a self monitoring, or we can stop the monitoring. Okay, or drug providers or healthcare workers they won't come and follow us. Okay, so this is the steps, various steps involved to conduct the tracing of the COVID patients. This some protocol will be there. It is initiated by the government. Each and every government have a separate protocol. For India, so this is the tracking conduct. Okay, next is genome of COVID-19. As we are all known that there is a single strand RNA genome will be there. The main culprit will be there is a S spike protein. There is a S spike glycoprotein is the main culprit. So this is only can be attached. This is the host cells. So this is the or virus. இந்த host cellsல எப்படி போய் இந்த வைரஸ் வந்து அட்டாச் ஆகுது அப்படின்னு பார்க்கணும். இந்த ஸ்பைக் புரோட்டீன் தான் ஹெல்ப் பண்ணுது. It has two subunits will be there, S1 as well as the S2 will be there. In this there is a domain will be there. Okay, there is a receptor binding domain will be there. In this receptor binding domain only, by using this domain, it can be attached to the ACE, that is angiotensin receptor 2. Okay, இதுல வந்து போய் attach ஆகி it can be entered. So there are 8 steps we used to say that. Okay, before we are going for this, let me discuss about the another proteins will be there. There is a envelope protein will be there, membrane protein will be there, as well as the nucleic acid protein will be there. So this is everything is required to spread, or you can keep in mind SARS-CoV is the parasites. What do you mean by parasite? Parasite is nothing but it doesn't have the mechanism grow their own. Oh, it required somebody else. It doesn't have the mechanisms. அது grow multiply ஆகிறதுக்கு அதோட ஃபெசிலிட்டிஸ் இல்லை. அதனால தான் வந்து நம்மளோட ஹோஸ்ட்ங்கிறது ஹியூமனுக்குள்ள வந்து அது எப்படி மல்டிப்ளை ஆகுது அப்படிங்கிறது படிக்கிறது தான். There is a 8 steps will be there. Entry as well as the transcription will be there, translations, assembly, budding, and there is a detachment will be there. This is like this. There is a 8 steps will be there. We'll study. Okay, in upcoming slides. Next slides we are going to be discuss. So இது ஏன் வந்து நம்ம தெரிஞ்சுக்கணும், இந்த ஜீனோம் பத்தி ஏன் தெரிஞ்சுக்கணும் அப்படின்னா, இந்த ஜீனோம் தெரிஞ்சா தான் நம்ம அதுக்கேற்ற மாதிரி நம்ம ட்ரக்கை டிஸ்கவர் பண்ண முடியும் ஆர் இன்வென்ஷன் பண்ண முடியும். எது போய் அட்டாச் ஆகுது? One possibility is the ACE. So another possibility, there is a cluster difference 147. So இது வந்து another way where it can be attached. And one more way, there are 3 ways the spike protein can be attached to the host. One is ACE, angiotensin receptor 2 enzymes. Okay, through that can be entered. Next is transmembrane protease serine 2. So this, by using this enzyme, it can be spike protein can be attached to this one. It can be entered. Okay, so like this, there are 3 ways where the host is going to be received the SARS-CoV. Okay. Next is the protein. It has 5' end as well as the 3' end will be there. 5' end will be the non-structural proteins. Okay, which has 16 types of non-structural protein will be there. So it doesn't have the role to multiply, or it required it doesn't require. Okay, it this for attachment only, but rest of the spike protein and as well as the this structural protein only, there is spike protein will be there. Spike protein, there is a 3A, 3B will be there. There are subunits will be there. So through this only it can be attached. Once we know the molecular mechanism only, we can able to identify, or we can able to give the proper drugs. நம்ம சொன்ன மாதிரி நோய் நாடி, நோய் முதல் நாடி, அதுதான் நிற்கும் வாய் நாடி, வாய்ப்பச் செயல், அதுக்கு என்ன காரணம் அப்படிங்கறது கண்டுபிடிச்சா தான் then we can easily treat the COVID. So this is required 6 months. You can see how difficult will be there. இதை கண்டுபிடிக்கிறதுக்கு எப்படி பரவுது, எந்த வழியா பரவுது, எது வந்து ஹியூமன்ல வந்து அட்டாச் ஆகுதுன்னு கண்டுபிடிக்கிறதுக்கு 6 months ஆச்சு. இன்னும் வந்து இட் இஸ் ரிக்வயர்ட் 6 months. எவ்ரிபடி இஸ் சேயிங் தட் ஏன் வந்து இன்னும் வேக்சின்ஸ் வரல, ஏன் வந்து இன்னும் ட்ரக்ஸ் வரல அப்படிங்கிறது. there are lot of procedures will be there to come into a market. ஒரு ட்ரக் மார்க்கெட்டுக்கு வர்றதுக்கு it required normally it required 10 to 15 years it will take. Okay, there are lot of failures will be there, lot of challenges will be there. That last webinar I have talked about that one. Okay, now we will focus on only the pharmacological action and as well as the non-pharmacological interventions we are going to be discuss. The next slides, how the entry will be there. I have told there is a ACE inhibitors mono, there is a transmembrane protease serine as well as the CD. இது வழியா வந்து உள்ள வந்துரும். இது உள்ள வந்ததுக்கு அப்புறம் there is uncoding will be there. Okay, I have told there is uncoding. After that there is a transcriptions. In this transcriptions there is a M protease as well as the PL protease as well as the RNA dependent RNA polymerase. So these are all the enzymes is responsible for the transcription. This is called as the transcriptional enzymes. It will transcript the one copy to the next copy, like that it can be multiplied. Next is translation. After that there is a assembling will be there. In Golgi apparatus it can be assembled. All the protein is going to be assembled there only, and after that there is a budding and assembly will be there. Then another viron, like this so many virons can be multiplied in our bodies. This is we are showing only one virus can be entered. Like this there is n number of virus or infinity virus can be multiplied like this only. Okay, next is pathogenesis of COVID. Okay, already we have discussed there is a respiratory droplet contact. Okay, மூக்கு இதில் வந்துன்னே வாய்க்குள்ளேயோ அல்லது ஃபீக்கல் அண்ட் ஓரல் கான்டாக்ட் அண்ட் ஆஸ் வெல் அஸ் ஏரோசல். நம்ம வெளியில் போகிறோம், அப்போ வந்து யாரோ தும்மி இருக்காங்க, அது வந்து இட் வில் பி சஸ்டைன் இன் the droplet can be sustained. There are several studies that shows that it can be sustained up to 24 hours or 15 to 24 hours. It is there in the aerosol. Okay, so once you are going to be entered into our nasal, okay, nasal cavity or pharynx, then it will be, this is upper respiratory tract, then slowly it can be go to the trachea. After that there are bronchi as well as the bronchioli can be entered. This is a lower respiratory tract, as well as it can be entered into a gastrointestinal mucosa. Okay, there what it will do, it will activate the T cells. Okay, T cells, we are saying that it is mainly involved in the immune. Okay, it will cause the, so once it is reached, it will activate the overactivations, will lead to the immune dysfunctions. Because of this immune dysfunction, there is a cytokine storms will be there. Cytokines is nothing but there is interleukins, TNF alpha, there are various cytokines will be released. This is the main culprit to causes the bronchoconstrictions. A lot of complication is going to be created. Next is acute respiratory disease syndrome. So it is there. Then finally the death is going to be assured. Okay, there is a viral replications will be there not only in the lungs, it will be there in the kidney as well as the heart, because the sometimes it can be go to the go to the kidney as well as the heart. Next is symptomatic viral sepsis is going to be started once it is entered into a blood. Okay, heart poishna, kidney poishna, it will be entered into a systemic circulation of poirum. So it causes viral sepsis. Inflammatory marker response, because cytokines can be multiple organ damage. Because of this only sepsis varadanaala multi organ is going to be damaged. Kidney illena purification illena can be dropped out. So this is asymptomatic irundha, idu vandu symptomatic irundha, idu vandu asymptomatic irundha enna agum, there is a ACE2 down regulations. It will be low synthesis of ACE. There is angiotensin receptor converting enzymes. Okay, dysfunction of RAS is nothing but there is a renin angiotensin systems. So once this only can be maintain our all the minerals. Okay, mineralocorticoids. Okay, renin angiotensin systems is going to be get dysfunction. Because of this, there is a pulmonary vascular permeability will be there. There is a pulmonary edema. So it will lead to the ARDS. There is acute respiratory disease syndrome is going to be finally the death is going to be assured. So this is based on the pathogenesis we have talked about. Next is categorize the COVID-19 patients. And there is a we'll go from the down onwards. Okay, there is a susceptible populations. There is a no herd immunity, as well as the all individuals are susceptible only. Everybody is once in front of me also there is some organism will be there. Once our immune system is going to be go down immediately, the domination of COVID is going to be will be enormous will be there. Next is importance of social distancing. Okay, self monitoring. Okay, we have to monitor ourselves. Okay, next is asymptomatic as well as the pre-symptomatic. There is unhatched spreaders, difficult to catch them. So immediately they will roam here and there. A lot of people as இதை வச்சும் கூட கண்டுபிடிச்சாங்க, டிராகன் வச்சும் கூட கண்டுபிடிச்சாங்க. There is a social distancing and avoid gathering. So once will be like this, we can able to manage the COVID-19. Next is mild. Here there is a compulsory, there is a home isolation is required. Okay, why we are showing these lines? Because everybody is panic. Okay, கோவிட் வந்துருச்சுன்னு சொன்னேன், எந்த ஸ்டேஜில் இருக்காங்க, சசஸ்டபிள் பாப்புலேஷன் இருக்காங்களா, ஏசிம்டமேட்டிக்கா இருக்காங்களா, மைல்டு இருக்காங்களா, மாடரேட் டு சிவியர் இருக்காங்களா, கிரிட்டிக்கலா இருக்காங்க, அவங்களுக்கு எதுவுமே தெரியாம நம்மளுக்கு கோவிட் வந்துருச்சு அப்படின்னு சொன்னேன். மேக்சிமம் பீப்புள் இறக்குறதுக்கு காரணம் வந்து there is a hopelessness. ஓகே, நம்மளுக்கு கோவிட் வந்துருச்சு அதனால நம்ம உயிரோடு இருக்க மாட்டோம் அப்படிங்கிறது தான். வெதர் வி ஹவ் அஃபெக்டட் இன் மைல்டா இருக்காங்களா, மாடரேட்டா இருக்காங்களா, கிரிட்டிக்கலா இருக்காங்களா, then we can give them. Okay, for what researcher is saying that home isolation is required for the mild infected. Okay, isolation self from the other family members. So we have to be there in the room only, even though your child or your wife or there is a blood relations, father mother should not be come and contact you or by visiting. Okay, so இது வந்து சின்ன கொடுமையான வேலை தான். நம்ம சொந்தங்களே வந்து நம்மளை பார்க்க கூடாது அப்படிங்கிறது வந்து இருக்கிறதுலயே வந்து ஒரு இக்கட்டான சூழ்நிலை தான். பட் there is no way நம்மனால மற்றவங்களுக்கும் அது பரவும் அப்படிங்கறது வந்து மனசுல வச்சுக்கிட்டு we have to home isolation is required. Next is need hospitalization. Moderate to severe இருந்தா டெஃபினட்டா வந்து அவங்களுக்கு வந்து ஆக்சிஜன் தேவை, they will admitted. Okay, so covid test எடுத்துனே வந்து மைல்டா மாடரேட்டாங்கற சிடி ஸ்கேன் எடுத்து பார்த்தா தெரியும் how far the lung conditions will be there. So immediately we need to hospitalize them. Okay, they need oxygen support, may require the mechanical ventilations, intensive care unit also it is required for them. Enroll the trials and the investigational drugs. Okay, immediately we need to start them, or before we are starting this we need to get a consent from them. So informed consent form, we have to get the signature, then we have to start. Okay, last is the critical need intensive care support. There is a mortality is going to be very high. Okay, next is enroll the clinical trials if it is available. Investigational drug can be started. Oh, here there is a symptoms have been started. What are the symptoms? The patients, because they have shown the symptoms like fever, severe fever will be there, cough, fatigue, okay, muscle fatigues will be there, and also seek medical help. Okay, so for these kind of patients is required. So this is symptomatic, this is the asymptomatic people. Okay, so this is how we need to categorize. So by seeing these slides we should not be panic. In the category la patients வர்றாங்க, நம்ம சொந்தக்காரங்களே வந்து இப்படி இருந்தாங்கன்னா நம்ம வந்து we should not isolate them. Okay, உனக்கு கோவிட் வந்துருச்சு அதனால உன்னை யாரும் பார்க்க மாட்டாங்க அப்படின்னா அவங்க மனசளவுலயே அது பாதிப்பு வந்துடும். அதனால வந்து we should not do that blunder mistakes. Okay, அது எந்த கண்டிஷன்ல இருக்கான்னு நமக்கு தெரியாது. So this is the next slides. Pharmacological approaches for the COVID-19. There is a total 11 drug therapy will be there for the COVID-19. Okay, there is antiviral drug therapy will be there like remdesivir as well as the favipiravir. This is the two drugs can be currently it is going to be there in the hackathon, or it is there in the final stage will be there. Soon it will be come into a market, and sometime it will be there in the market also. Okay, Glenmark company, Hetero company. So there's two vial. One is vial remdesivir. So this is favipiravir will be there. German Remedies has introduced this one. Okay, the two drugs is going to be play a vital role nowadays. Next is anti-malarial drugs like hydroxychloroquine. Immediately வந்து நம்ம ட்ரம்ப் நாம தான் ஒரு இது பார்த்தோன்னே. So it has action, but severe cases வந்து it doesn't have any remarkable changes. It won't be done. So that's why they are not recommended. And also there is a drawback for the hydroxychloroquine. There is a QT interval. நம்மளோட ஹார்ட் பீட்டை வந்து இது இன்க்ரீஸ் பண்ணுது. QT interval in the sense நம்மளோட ECGல வந்து there is a QT interval அப்படிங்கும். அந்த QT interval prolong பண்ணிச்சுன்னா there is a jerkies will be there. Our heart beat வந்து 72 beats per minutesங்கிறது இருக்கிறது it can be goes. இது வந்து elder people தான் most affect ஆகுறாங்க. So it is not recommended for them. Next is antibiotic and anti parasites. Sometimes you are going to be used azithromycin and doxycycline. There are three combinations nowadays this kind. Okay, doxycycline, ivermectin as well as the zinc. So there is a key three combinations will be there. I don't know how far it is rational use only. தகுந்தார் போது கொடுக்கணும், சும்மா எல்லாத்தையுமே போட்டு கொடுக்கறத விட. So we have to some clear cut idea, then only we can introduce into the market. Okay, so that's why there is a foreign company, they are not touched in the combinations. They will go with the single drugs, and then once they were successed, then they will try with the next drugs. Okay, there is a non-specific inflammatory and immune suppressor. Okay, there is a corticosteroid obviously. There is a betamethasone, beclomethasone we have to give. Okay, to control this one. Leflunomide, thalidomide, colchicine. These are all the some drugs can be given for the gout. Okay, goutங்கிறது வந்து யூரிக் ஆசிட் வந்து நம்ம முட்டியில வந்து சேர்ந்துக்கிறதா வந்து கவுட்டுமா. Next is kinase inhibitors like imatinib, tocilizumab. So these are all the some in molecular level that you're not understand. Okay, I'll go with a little bit idea. Kinase inhibitors only, I'll not go in depth. Okay, there is a kinase is the another protein which will be there in the molecular level inside the host cells. Once you're going to be inhibited this kinase, so multiplication of viral can be inhibited. Next is monoclonal antibodies. This monoclonal antibodies usually we need to give the binding sites. Okay, CD is the cluster difference I've told. Okay, so in this cases there's a monoclonal antibody which prevents this entry so that we can easily escape from them. Okay, next is hormonal preparations like progesterone, sildenafil citrate, as well as the estradiol patches also will be helpful sometimes. It's not authenticated one. Next is cardiovascular drugs like ARBs as well as the AC inhibitors, losartan, valsartan, ramipril. So these are all these some ARBs, angiotensin receptor blockers. Angiotensin enzymes block ஆகிறதுக்கு once you are going to give this losartan, valsartan, all those things can be inhibited. Next is blood and blood forming organs. There is a normostate mesylate as well as synthesis serine protease inhibitor, whereas transmembrane protease serine inhibitors like homostat mesylate. So this is the 11 drugs, and in addition to that, we have to boost our immune systems so that there is a non-pharmacological actions will becomes. Okay, vitamins and supplements. Vitamins like vitamin C have some roles will be there, and D also will be there because it will be play a vital role in a hemopoietic systems, so that can be easy. Can I audible, ma'am? Once again. I'll check whether it is audible.
Hello, sir, can you hear me, sir? You're audible, sir.
Madam, it is audible, ma'am?
Yes, sir, you're audible.
Okay, okay. Thank you, ma'am. Thanks for your response. So this is a proposed target for the important drugs candidates or pharmacological actions, okay, where it will be stopped. So this is the various 11 drugs we have discussed now. That there is a corticosteroids we have discussed, there is a monoclonal antibodies we have discussed. We are going to be stop this AC inhibitors. There is a losartan, ramipril, valsartan. There is a nefuzimab, mesylate, as well as the homostat mesylate. So these are all these some drugs will be inhibits this entry. Okay. Next is some drugs will be stop this remdesivir, favipiravir, and galidavir. All those things it will be inhibits this RNA dependent RNA polymerase, so that there is ivermectin can be replication can be stopped. Okay, ivermectin usually we are going to be give vermicidal. Okay, நம்ம உடம்புல வந்து இண்டஸ்ட்ரைன்ல வந்து வெர்மிசிட் பண்ணிட்டே இருக்கணும். வெர்மிசிடல்ங்கிறது வந்து நத்திங் பட் there is a அந்த புழுவெல்லாம் இருக்குன்னு சொல்லுவாங்கல்ல, அதை வந்து ஸ்டாப் பண்றதுக்கு there is a ivermectin we are going to be give, and albendazole. Usually everybody is known we have to deworming our every 6 months once we need to deworming. Okay, next is, so this is the proposed target for the most of the drugs. Next is non-pharmacological approaches. Usually COVID caused virus, caused by virus, already we have known that. Okay, already we have talked about that. Okay, to which probably the people will low immune response were being affected mostly. Okay, the plant-based food or increase intestinal beneficial bacteria, which are helpful for make up the 85% of immune systems, so that once the immune system is going to be conquer against the COVID-19, it will be good. Okay, by use of plenty of water as well as mineral like magnesium, zinc, micronutrients, herbs also sometimes we are going to be used like nilavembu kudineer, kabasura kudineer, everything it is comes under the herbs. Okay, that we are going to be discussing in upcoming slides. Food rich in vitamin C like broccoli, there is a citrus fruits, orange அல்லது சாத்துக்குடியோ, we have to frequently we have to supplement, or we have to give, or frequently we have to take this kind of food. Okay, vitamin D as well as vitamin E. Okay, which contains a lot of vegetable might contain this type of vitamin. This is a water soluble, fat soluble vitamin is the E and D. C is a water soluble vitamin. Okay, and better lifestyles one can promote the health, can overcome any kind of diseases. Once you are going to be some என்ன தமிழ்ல என்ன சொல்லுவாங்க அப்படின்னா, சுகர் இருந்தா தான் சித்திரை வரைய முடியும் அப்படிங்குவாங்க. அந்த சுகரை வந்து நம்ம கரெக்டா வச்சுக்கணும். சுகருங்கிறது இங்க வந்து மீனிங் வந்து நம்மளோட வால் இல்ல, நம்மளோட உடம்ப வந்து பக்குவமா பாத்துக்கிட்டோம்னா we can free from the disease, any kind of disease, not only this COVID, there are various diseases also we can overcome. So we have to fit our body. Okay, various studies investigated that the powerful antioxidant like glutathione and bioflavonoids like quercetin may prevent various infections including COVID-19. So this is one of my study. Okay, anti-cancer there is a quercetin we have used. Okay, there is a bioflavonoid in developed country, Western countries, they were using very frequently. In food also they have added this quercetin. In our country we have not added, but still we are using a balanced diet. Okay, which contains யூஸ்வலி நம்ம டயட் தான் வந்து பெஸ்ட் டயட் அப்படிங்குவாங்க. இந்த இதுலயே நம்ம இட்லி எப்படி நம்மளுக்கு சாஃப்டா வந்து டைஜஷன் ஆகிறதுக்கு ப்ரிப்பேர் பண்ணாங்களோ வேர்ல்ட் லெவல்ல ஃபேமஸ் இட்லிங்கிறது, அதே மாதிரி நம்மளோட ஆஃப்டர்நூன் செஷன் ஃபுட்டும் அப்படிதான், which contains all the spices. Okay, there's a ரசத்துல வந்து there is a pepper will be there, contains piperine. There is a curcumin will be there by adding the turmeric as well as the அந்த புளியில இருக்கிற அந்த உவர்ப்பான தன்மை. ஸோ எவ்ரி திங் கேன் பி காம்பேக்ட் டு எராடிகேட். அதனால தான் வந்து இந்த சூப் வந்து அடிக்கடி கொடுத்துட்டே இருப்பாங்க. ஈவன் யாராவது கோவிட் பேஷன்ஸ் இருந்தாங்கன்னா கேட்டு பாருங்க, ஃப்ரீக்வெண்டா இந்த ரசம், மிளகு ரசம் இந்த மாதிரி கொடுத்துட்டே இருப்பாங்க. பாலில் வந்து பெப்பரை போட்டு கொடுக்கறது, பாலில் வந்து குர்குமின் ஆட் பண்ணி கொடுக்கறது, டெர்மரிக். ஓகே, டெர்மரிக் விச் டெர்மரிக் கண்டைன்ஸ் curcumin. So it's a bioactive flavonoid. So also it is a flavonoid only. Okay. And for healthcare workers, everybody is saying that there is a PPE. PPE kit is very must. Once you are going to be wear this, it is very difficult for them. நம்ம 8 hours வந்து இது எதுவுமே ஒன்று வந்து கவுண்ட் மாதிரி இருக்கும், அப்படி போட்டுக்கணும். இதெல்லாம் வந்து கவுண்ட் will be there. There is a head seal will be there. There is a head cap will be there. There is a mask will be there. So after that N95 mask will be there. Then gloves will be there. Then above this there is a specs, we have to wear the spectacles. After that there is a seal, face mask or face seal will be there. This is called the face seal. Okay, so இதெல்லாம் வந்து போட்டுட்டு போனா தான் they will be secure their body. Okay, now together we can. Okay, here there is a 5 steps will be there. The individual what we can do once achieve the goal of stop the COVID-19 spread or free from the COVID-19 அப்படிங்கிறதுக்கு என்னென்னலாம் பண்ணணும், இண்டிவிஜுவல் என்ன பண்ணணும் அப்படின்னா, you have to stay in the home, cover while coughing. Okay, hand washing properly you have to do it. Call if feeling sick. Okay, self monitoring, you have to keep on monitoring ourselves. Home quarantine is required. Avoid touching your face. அதான் சொன்ன மாதிரி 300 times வந்து நம்மள அறியாமையே 300 டைம் வந்து நம்ம ஃபேஸ்ல வந்து டச் பண்ணிட்டு இருக்கிறோம் அப்படிங்கறது ஒரு ரிசர்ச் ஃபைண்ட் அவுட் பண்ணிருக்காங்க. there is a disinfector frequently use for the objects. Okay, அதனால தான் நம்ம போனதுக்கு அப்புறம் ஒவ்வொரு டைமும் அதை க்ளீன் பண்றாங்க. ஹாஸ்பிட்டல்ல வந்து சேரையோ அல்லது வந்து எல்லாமே வந்து என்ன நினைப்பாங்க, இந்த பேஷண்ட்னால மற்ற பேஷண்ட்ஸுக்கு there is a nosocomial infections will be there. அதனால தான் வந்து அவங்க இந்த ஸ்பிரிட், ஹேண்ட் சானிடைசர், டிஸ்இன்ஃபெக்டன்ட் போட்டு கிளியர் பண்ணிட்டே இருப்பாங்க ஒவ்வொரு டைம். ஒவ்வொரு பேஷண்ட் போனதுக்கு அப்புறம் இட் ரிக்வயர் another 2 to 3 minutes to clean everything. ஓகே, இது வந்து பிஸி டாக்டர்ஸ் பண்றது. லுக் அவுட் அவர் சிக் பர்சன் இன் அவர் ஃபேமிலி. அவங்கள விட்டுட்டு ஐயோ கொரோனா வந்துருச்சுன்னு ஓடக்கூடாது. அவங்கள வந்து we have to take care for them also. Okay, if child feels sick, don't send them to school or call doctor and confirm it whether the child, because only the young people as well as the elder people only morely or more versionally is going to be affected. Okay, old and comorbid we have to comorbid condition cases or aged group we have to take care of them. Okay, extra take care we have to do it. Next is once நம்ம கிளீனா இருந்தா தான் கம்யூனிட்டிக்கு போக முடியும். அப்ப கம்யூனிட்டியில வந்து என்னென்ன பண்ணணும் அப்படிங்கிறது வந்து everybody together. That's why I have mentioned together we can achieve the goal to stop the COVID-19. நம்ம என்ன பண்ணணும், சொசைட்டிக்கு போனோடனே நம்மளோட தனி ஒரு விருப்பத்தினால என்ன பண்ணிக்கணும் அப்படின்னா சோசியல் டிஸ்டன்சிங். அடுத்தவங்க பண்றானோ இல்லையோ நம்ம மெயின்டைன் பண்ணுவோம். அது வந்து நம்ம கிட்ட இருந்து தான் மாற்றம் வந்து உருவாகும். ப்ரொமோட்டிங் 6 feet distance for rule we have to maintain it and preventing the rumors. அதே மாதிரி இந்த வாட்ஸ்அப்ல வர்ற மேக்சிமம் இப்போ வந்து we have to laugh. ஓகே, இல்லாதது இருக்கிற மாதிரியும் இருக்கிறது இல்லாத மாதிரி கொண்டு வரது தான் வாட்ஸ்அப்புங்கிற மாதிரி ஆகி போச்சு. நோ மாஸ் கேதரிங். ஸோ அதனால தான் வந்து கல்யாண காது குத்துலாம் வந்து நம்ம மாஸ் கேதரிங், அதான் கோயில்ல வந்து கூட்டி வச்சிருந்தாங்க, சர்ச்சை க்ளோஸ் பண்ணி வச்சிருந்தாங்க, பிகாஸ் ஈஸிலி கேன் பி ஸ்ப்ரெடட். நம்ம ரெண்டு வகையிலையும் இப்போ கவர்மெண்ட்டை பிளேம் பண்ணலாம். ஒன்று வந்து ஏன் வந்து இன்னும் விடல அப்படிங்கிற மாதிரியும் பிளேம் பண்ணலாம். விட்டுருந்தா again the same government is going to be responsible to take care of our entire populations அப்படின்னு நம்ம சொல்லியிருக்கோம். So it is pathetic condition for them also. Okay, government also have a decision making la it has very tough challenges they are facing it. Okay, government officials. Okay, next is blood donations. We can encourage that cooperation in cooperate with the healthcare workers in this quarantine in the stations. We should not home here and there, and fundraisings we have to raise the fund. Okay, next is treat everyone equally. So already I have told, ஒரு டாக்டர் இறந்துட்டாரு, அவர் கொரோனா ட்ரீட் பண்ணிட்டு இருந்தவர் தான் கொரோனாலே இறந்துருக்காரு அப்படின்னா அங்கே புதைக்க விடல அப்படின்னா யூ காட் டு ட்ரீட் ஈக்குவலி. ஓகே, இதனால புதைக்கிறனாலையோ அல்லது எரிக்கிறனாலையோ இந்த COVID-19 இட் won't be spreads. Okay, definitely. So there is a safety precaution எடுத்து தான் they will dispose the body. Okay, next state என்ன பண்ணணும் அப்படின்னா they have to follow the law and order. அதனால தான் வந்து இந்த லாக்டவுனே கொண்டு வந்தாங்க. available for the essential. Okay, availability of essential, பால் இதெல்லாம் வந்து விட்டுருந்தாங்க. பால், தண்ணி, சம்டைம்ஸ் வந்து இந்த ஸ்டேஷனரிஸ் there is a இந்த மளிகை ஜாமான் என்னென்ன வேணுமோ ப்ரொவிஷனல் ஸ்டோர்ஸ் எல்லாம் ஓப்பன் பண்ண சொல்லியிருந்தாங்க. ப்ரிவெண்டிங் hoarding and PPE kit is must. ICU beds whether it is like adequately it is there or not அப்படிங்கிறத செக் பண்ணிக்கணும். Contact tracing I have already told. Rapid and reliable diagnosis. ரேபிடாகவும் இருக்கும், ரிலையபிளாகவும் இருக்கும். ஒரு பேஷண்ட்ஸ் கொடுத்துட்டு போயிட்டு சில டெஸ்ட்ல வந்து 7 to 8 hours it takes. இப்போ சில இதெல்லாம் வந்து என்ன பண்றாங்கன்னா லேட் பண்ணிடுறாங்க. 24 hours லேட் பண்றதுனால இந்த பேஷண்ட் மே வெக்ஸ் சம்டைம்ஸ். ஸோ ரேபிட் அண்ட் ரிலையபிளா இருக்கணும். அதான் சொன்னாங்க, இதுல இருந்து வாங்கினது வந்து சைனால இருந்து வாங்கின ப்ராடக்ட் வந்து எல்லாமே ஃபெயிலியர் கேசஸ் ஆகுது. இந்த ரேபிட் கிட் வாங்கினது ஃபுல்லாவே வந்து இட் டசன்ட் ஒர்க்ஸ். ஓகே, அதனால வந்து ரிலையபிளாகவும் இருக்கணும். அது infection prevention and control system should be pakka. Next is essential resource planning as well as the national lab should be equipped. Okay, in a state level. Next is country level, nation level என்ன பண்ணணும் அப்படின்னா travel should be banned. அதனால தான் வந்து இந்த 5 மாசம் 6 மாசமா வந்து என்ன பண்ணியிருந்தாங்க, டிராவலை வந்து பேன் பண்ணியிருந்தாங்க. ஃப்ளையிங்காக இருக்கட்டும், ட்ரெயினாக இருக்கட்டும், பஸ்ஸாக இருக்கட்டும், எல்லாமே வந்து லாக்டவுன் பண்ணியிருந்தாங்க. நெக்ஸ்ட் இஸ் டெஸ்ட் கிட்டிங் அவைலபிள். Essential drug is available or not, we have to check. Ventilator, ICU bed sufficient is there or not, we have to check. Contact tracing, there is a screen of airports. Okay, financial aid we have to give, and we have to give a immediate actions we have to take it. And globe or internationals, WHO we need to update. There is a World Health Organization, frequently they are once in 15 days they are going to be update. You go and visit the so many updates is given, same guideline. There is 2238 pages guidelines it is given. It is updated in the October 30th. Okay, you can go, and World Bank support is required. Financial aid is required to purchase this PPE, all those things. Okay, and ventilator. There is ECMO. ECMO is the last stage. Okay, once lungs is not properly function, then we have to do the tracheostomy. So after this tracheostomy, then tracheostomy nothing but we are going to be insert the tube and artificial lungs, whatever it is can be, that is called the ECMO. Okay, next is clinical trials. Immediately we have to switch over. There is a UNICEF. We have to coordinate all the funding bodies, and we have to global wise this also can be get together. So it starts from the individual to the national or international level. Everybody has to be coordinate on everybody. Comes together, then we'll succeed in our target. What we can do, okay, as an individual person, no handshake, high five should not be there. You have to keep 6 feet distance. Work from home is remotely. Okay, try to stay at home. Okay, avoid the crowd spaces and wash your hand very frequent manner. Okay, next is our government has initiated. Okay, so Siddha guidelines, the immune boosters like antiviral Siddha formulations, Kabasura Kudinir, Nilavembu Kudinir, Visabasura Kudinir, Pavala Parpam, Velli Parpam. So these are all some immune boosters. Okay. In addition to that, there is a Antiviral siddha herbs will be there. Ginger, okay, inji, tulasi, milagu, karunjeeragam, okay, keelanelli. So these are all the some antiviral siddha herbs will be there. So once you are going to be take this one, we can boost our immune system, but indirectly after pharmacology system na after வந்ததுக்கு அப்புறம் என்ன பண்ணணும், இது வந்து வருமுன் காப்போம் அப்படிங்கறதா இதோட மெசேஜ். Ginger வந்து they have done various research on that, okay. It has shown enormous or promising to treat the COVID, okay. Ginger physiology, and they were isolated the 6 gingerbread, okay. Through that we can do. இது வந்து நம்ம யூஸ் பண்ற டர்மரிக் மஞ்சள், இந்த மஞ்சள்ல வந்து என்ன பண்ணும் அப்படிங்கிறதுக்கு வந்து மஞ்சள் has several actions. Even it can be prevent after once it is entered, replication can be inhibited, as well as the main protease is going to be target. M protease I told you. So inflammatory marker also it can be inhibited. It has several actions will be there. So it is promising drugs. There is a under trial only. US FDA has approved, partially approved. There is a unapproved label. It becomes. There is a future perspectives. There are several studies. Ginger, tulasi la பண்ணிட்டு இருக்காங்க. And red neem, okay, red onion, which contains a quercetin. Neem li பண்ணிட்டு இருக்காங்க. Turmeric I have told already. There is a black pepper as well as the karunjeeragam, okay. இதுலயும் there is a several studies is going on. இது என்ன பண்ணணும், no interventions, okay. Pharmacological இருக்கட்டும் அப்படி இருந்தனா இது வந்து ரெட் அலர்ட் காமிக்குது. No interventionலாம் எவ்வளவு தூரம் போகுது, number of cases is going to be increased, okay. Once you are going to be implement all the precautionary measurement, avoid touching face, nose, hand wash frequently, and no handshake, disinfectant. So there is some studies they were performed. So with interventions, it is gradually it has been reduced, okay. The number of cases is going to be reduced, okay. This is some graph I have to show why the non-pharmacological intervention is required, okay. Conclusion, okay. Currently there are limited number of allopathic medicines available. You have to keep in mind, okay. If you take against the COVID-19, to design development of drugs and vaccines required elucidation. There is a complicated process I have told. There are several challenges we need to meet out. So the current literature provides abuse evidence supporting dietary therapy. There is dietary therapy in the sense dietary we have to add our all the healthy food, okay, herbal medicines as potential effect of antiviral against COVID-19 or SARS-CoV-2, okay, preventive agents against the COVID-19. The final conclusion will be the plant-based food play a vital role to enhance immunity. So once you are going to be develop the immunity, immediately there are the people can be control the COVID. Okay, this is one kind of approaches. However, these approaches, whether it is a pharmacological approaches or non-pharmacological approaches, require experimental validations in SARS-CoV infection models as well as the COVID patients live நிறைய பண்ணி then it will be coming to a market. நம்ம இப்போ என்ன பண்ணுவாங்க அப்படின்னா இதில் வந்து 1000 or 1 lakh பீப்புளுக்கு மட்டும் தான் பண்ண முடியும் கிளினிக்கல் ட்ரையல்ஸ்ல. இப்போ மேசிவா வரும்போது there are several complications. அதனால தான் வேக்சின்ஸும் இன்னும் வந்து ஃபுல் ஃபிளெஜ்ல எல்லாத்துக்கும் கொண்டு வர முடியல அப்படிங்கிறதுக்கு ரீசன் தான். So this is our department research work carried out in our college, okay. In vitro studies, antioxidant and Alzheimer cytotoxic studies we are going to be performing here, anti-diabetic also, and we have pharmacognostical studies, extraction isolation of this kind of gingerol, quercetin isolations, everything we can do in our cognostical lab, okay. In vivo studies like analgesic and inflammatory. So these are all the some studies we are going to be performing. Wound healing, toxicological, skin irritation test. If anybody know or anybody want to do it, feel free to contact me, okay. So this is some value added courses we are going to be offer in our college. Animal handling techniques as well as the route of how to administer the drug into animals, either it is a rat, mice or rabbit. There is different blood collections, how we are going to be blood collect, because once you are going to be blood collection only we can do it, or we are going to be analyze various biochemical parameters. Next is euthanasia is nothing but there is anesthesia கொடுத்து தான் சில டெக்னிக்ஸ் எல்லாம் நம்ம சில ஸ்டடீஸ் எல்லாம் பண்ண முடியும். Certificate course for the PCR and RT-PCR techniques, certificate course for the virtual learning of animal models, okay. So these are all the things we are going to be on the pipeline. Last two is the pipeline. Okay, less of them we are doing it. Very frequent hands-on training we are giving. Okay. With this quote, I am going to finish my Varumun Kapade Sirandadi. That is, prevention is better than cure. Thank you all for your patient listening.
Thank you, sir. You have made this quote through. A pharmacist gives life to medicines through his knowledge and skills. Your brief insights on COVID 19, its causes, and prevention measures through natural medicines really helped us to be safe and secure from COVID. A special thanks to you, sir, on behalf of Karpagam Institute of Technology. Thank you so much, sir.
Thank you, ma'am. Thanks a lot.
Thank you, sir. So it's in information for the students. Students, now that time is 11:32. Okay, you can go for break for 10 minutes and you have to join by 11:45. Okay,
Yeah, any questions
already
you
the
can put.
Google
Any
chat.
question is there, let them ask. We'll wait for another 5 minutes.
Okay, sir. Okay, sir. Yeah. So
In
students, if
chat
you
box.
have any questions, you can use the chat box to put the questions.
If it is not there, then I'll conclude, ma'am. Thank you, ma'am. Thank you for giving this opportunity, and I'll like to thank our Gopinath sir, Dr. Gopinath sir, as well as principal sir, and I want to thank our principal sir, Dr. Mohan sir, as well as our management Karpagam Institute. Thank you, ma'am. Thank you all.
Thank you so much, sir. Yeah. So students, please log in your Google Meet link by 11:40. The session will start at 11:45. Okay, you will be going to see the introduction of various club activities that will be performed in our college. So please join by 11:40. You can go for break and join by 11:40. Our session will start at 11:45. Use your Google Meet link that is already sent to you, that is there in the agenda. Thank you so much.
Can I leave, ma'am, now?
Yes, yes. Yes,
Thank
sir.
you.
Yeah. Join by Google Meet link for the next session. Don't use the YouTube link. Please join with the Google. Okay, Google Meet link. Thank you, students.